Hello, Dr. Stan Kovtun, back again today with more questions and answers. You can reach me here at Alpha Plus Dental Center anytime you want, or you can reach me via email or Facebook. But the latest questions are coming in are about ozone therapy. What is ozone therapy in dentistry and how can it be utilized? So ozone therapy in dentistry is the ability to create ozone gas, which is then used to either make ozonated water, or you can use the gas yourself, or we can use it in a tray system, which I will go over. So this is an ozone generator. Inside there is an electrical arc that is created as oxygen goes through the ozone generator, through the electricity, you create O3, and then the gas comes out of this and goes into the bubbles. So I'm going to turn it on right now. And you're going to hear a distinctive sound. So right now the unit is working. Oxygen is flowing into the unit through the electrical arc. Just like in a lightning storm, when you smell ozone outside during electricity, it's the electricity going through the air that generates ozone. Same thing in this unit. So now we have ozone being generated that is bubbling into this water. The other thing that I can do with is, instead of taking the ozone into the water, I can pull it into this syringe. So I'm going to put it into the syringe port. And then you're going to notice this syringe is filling up with ozone gas. Now we're going to switch it back into the water. So now this syringe is full of ozone gas. And we essentially can now apply it through the tip of this in any area that we want. In and around the gums, in deep cavities, to kill bacteria. So you just witnessed me generate some ozone. So I have ozone in this syringe. There is a way for me to bubble ozone into the water, along with bubble ozone into oil, into olive oil, which you can then pull between the teeth. But another way for people that are battling periodontal disease, or just want to have ozone applied to every single tooth at the same time, this is an ozone tray system. So what happens is the unit gets turned on. We have ozone coming out of this silicone tubing into this tray. So imagine ozone is coming in. We turn the suction on this side. Now the suction creates a tight seal. Ozone is coming in, going through the entire tray system around every single tooth, and then getting suctioned out of this end into the suction system. And so the patient would sit with this tray in his mouth for about 10 to 12 minutes, several times during the therapy procedure. So you would come back 4 times a year for this procedure, right along with your cleanings. And you would have this done. So this would get done to the bottom jaw. We have the same exact tray system for the upper jaw. So this is how the ozone therapy trays work. Finally, if you can imagine, this glove here has a makeup similar to kind of like what a bacterial wall is made up of. So I have ozone in this syringe. So what I can do is I can pull this kind of tight and show you, for instance, an area where I'm just literally expressing ozone gas. I'm not touching, and you can just watch that rip. So that's exactly how it kills bacteria. It can do it from a distance. It penetrates deep into the tooth, into a cavity, to kill and stop that cavity from continuing. And then we place the filling on top to keep it clean. So that is how ozone therapy works in the dental practice.